Jay Chaudhary. I'm a senior fellow for mental health and wellness at Sagamore Institute.
Can you tell me a little bit about your mental health journey?
Yeah, so personally, I've been, I think fairly fortunate that I've never had to, deal with mental illness. That said, I think, like everybody else, mental health is up and down, and I think like a lot of folks, during the pandemic was when it really, um, hit me personally that this is something I got to take care of. And so, I do my best to, I have a few sort of practices that I incorporate to, keep myself, in a good headspace. I journal, I meditate, I exercise. And if I don't do those things, I definitely notice a significant drop in my own mental health. So that's my own personal mental health story. But professionally, I've been in and around mental health and folks working in the mental health space for my entire career. So I call myself a recovering lawyer. So I started out as a lawyer in the world of civil legal aid. Which is, the thing most people know about civil legal aid is like things like eviction defense or helping people with consumer law issues. And so when I graduated from law school, I went to work for a place called Indiana Legal Services, which is a civil legal aid organization. And at Indiana Legal Services, I built a few programs called medical legal partnerships, where we would help folks with or help people, providers of mental health services, largely help their clients with civil legal issues. So like the classic example was, one of my clients would be facing an eviction due to having a decompensation episode of mental illness. And so, we'd get involved and talk to the landlord and try to work out an arrangement where they could, stay in their housing, because I'm sure, as you know, and a lot of your listeners know, there's no kind of like separating somebody's mental health or overall health from the conditions of their life, right? I mean, they
Right.
call those social drivers, social determinants of health. And I think, um, that's even more applicable in the mental health context. So anyway, I built, I built quite a few of those programs with behavioral health care, so a substance use disorder as well as mental health, and developed a bit of a national reputation in the space. And so in 2019, I was hired to take over the Indiana Division of Mental Health and Addiction. So in that role, I was the state mental health commissioner, as well as in charge of all of Indiana's substance use disorder infrastructure. And so I did that job for 5 years, including the pandemic, which was pretty wild.
Yeah.
And I left that job in October of 2024, and I've since been just kind of thinking and writing and speaking about mental health, both narrowly and more broadly, at an organization called Sagamore Institute, which is a think tank based in Indianapolis.
Yeah, what were some of the challenges during coronavirus?
Yeah, I mean, so I always tell the story, but they told me when I took this job over, first of all, I had no business getting this job, to be completely honest. I went from managing a legal aid office of 30 people to a huge organization, including running 6 state hospitals, with 2,000 employees, right? And being in charge of a budget of $500 million, right? Like, I probably skipped 2 or 3 levels in terms of, my career journey. And so it was overwhelming, but people would always tell me, give yourself 6 months, get the lay of the land, and then start making your plan, right? And as it turns out, 6 months for me was March of 2020. And so, right as I started to get my feet under me, the whole world changed, right? And so it was a double-edged sword, right? Because I think obviously, mental health issues skyrocketed. The whole business and mechanics of state government changed dramatically. And I had to sort of learn really quickly how to, how to operate in a context that I was still pretty unfamiliar with. But the silver lining of the pandemic, I think, largely was that for the first time, a lot of folks who had never really thought about mental health were confronting their own mental health challenges, right? And so there was this really, really inspiring and galvanizing energy behind the idea that we need to do more and better things for mental health. And so, um, that was, I think, the impetus and the driving force behind some of like the large systems level changes that we were able to make under my leadership. And I can
How
talk about
important?
those if you want.
Yeah. How important is a tool like empathy when you're working on the professional level?
Yeah, and I think in policy in particular, it's, people lament the fact that most people don't care uh, about an issue until it touches them personally, but it's just human nature, right? And so
Hmm.
we saw this play out, I think, really in the opioid crisis, where, um, you know, forever there was this huge stigma against addiction as something that happened to kind of those people, right? Or other people, or people that aren't us. And so I think what you had during the opioid crisis was, for the first time, people who had had the luxury of ignoring addiction had it touch their own lives, right? Whether it's a friend or a neighbor or a son or a daughter or a niece or a nephew. And you really saw this sort of massive sea change of how we viewed addiction. Now, you can't talk about that, and I always say this, you can't talk about that without also mentioning the racial dynamic of this. Um, Addiction, I think, had been seen forever as a problem in more minoritized communities, and I think that once there's a line from Andre 3000 of Outcast, which is, one, and then it spread to the whites and got everyone's undivided attention. And I think he said that tongue in cheek, but he, I think, that's true. And so, even though it was a change in the right direction, I always like to point out that there was, some other kind of social dynamics behind it. But overall, I mean, empathy and the ability to see yourself in the stories of the people you're serving is I think the core, like the foundation of effective policy.
About a year ago, I was watching a hearing on Capitol Hill with Jelly Roll, and he talked a lot about substance abuse and mental health need to be talked about in the same sentence. Do you agree with that?
Absolutely. There's a saying in the recovery community, and I've, the recovery community has, is the leader in sort of pithy and wise sayings. But there's a saying in the recovery community that people use drugs for reasons, right? And I have always tried to keep that front and center. Like, we too often in substance use disorder, we focus on like the drugs or the substance or the behavior, but I think we need to do a better job of focusing on the reasons that people choose to go down, or people go down that road. There's another saying which I love, and I'm just repeating things that are not things I've made up, but that trauma is the real gateway drug, right? So like
Yeah.
this idea that there's this popular notion, which is, backed by some evidence, but also, not that strong, that, there is this concept of gateway drugs, first cigarettes, then marijuana, then harder, stronger drugs. And, that's, look, I think that there is, like, things are nuanced and complicated, and there's probably some truth to that. But I think that the real truth is when you look at somebody, who has a higher level of adverse childhood experiences and a higher level of trauma, they are much, much more likely to end up with a substance use disorder condition. And so what that tells me is that, rather than focusing on the drugs, we should focus on the reasons.
You said earlier about now you do public speaking. What is it like getting the message out to people you then see?
Yeah, totally. I mean, again, I'm aware of, and I think since I've left the state, I've become even more aware of the fact that I had the privilege and just like the luck of working in this space at a time when attitudes were changing rapidly, right? So I've talked to a lot of people who have been at this for decades, right? And just would hit like brick walls, right? They'd be out there talking to policymakers or legislators or county commissioners or whoever, or sheriffs, law enforcement, and you'd hear the kind of same message, right? Mental illness isn't real, or it's people's faults, or addiction is the fault of the person who's suffering the addiction. It's not, a lot of stigma, a lot of dismissal. And I was fortunate to come on board to a leadership role in this field when those attitudes were changing rapidly. So I'll be honest with you, I almost got nothing but good support and feedback from most of the people I talked to. It was everybody agreed that this is something we need to work on. Everybody agrees that this is something we need to do better. And that sort of alignment across fields, across parties, across disciplines has been the driving force behind the progress we've made in Indiana.
You touched on a little bit, but what do you do to help your own mental health?
Yeah, like I said, it's I am being aware of it. Awareness is the key. So I journal, right? I was very resistant to this for a long time. People always tell you journaling is is magical, and so I started this only this year. And I'll tell you, like it is revelatory. Just to be able to like write down, and sometimes I'll write 3 words, sometimes I'll write 3 sentences, sometimes I'll write 3 pages. But it's just to be able to get out on paper what's in your brain first thing in the morning has been just truly, truly transformational for me. And then, like I mentioned, exercise and meditation, or meditation's a pretty new one too. I'm on like a 32-day streak right now of meditation, and I'll tell you, it is worlds apart. And to give you a specific example, I think what it does is it makes you more resilient. Like, forever my only mental health outlet was exercise, and I hurt my knee. It's not bad. Just don't worry, I'll be all right. But I'm taking a bit of a break from exercising because to let my knee heal. And previously, that would have sent me into a spiral. But now that I've been meditating for about a month in a row, like I'm dealing with it much better. So I think like creating more resilience internally is sort of is my mental health path.
And you said earlier you're a fellow now. Can you talk to me a little bit about that?
Yeah. So we had a lot of success in Indiana, behavioral health wise. I was fortunate to be the chair of the Indiana Behavioral Health Commission, which was a body put together by the legislature and appointed by the governor to make big, bold recommendations to change and improve the behavioral healthcare system. And our recommendations were very well received. And in 2023, we were able to secure a lot of new funding and a new infrastructure for behavioral health in Indiana. And so, I say that all to say, I'm in a pretty unique position because I've both written and driven policy for behavioral health, and I've also overseen the kind of execution of implementing that policy, right? And so usually there's different people doing those things, and so that's the lens that I wanted to, just kind of like play with and do a deeper dive on some of the things that I learned in that process. And so, short version, I had an opportunity, with some funders to have like a 2-year, fellowship of sorts, where I could do things like I could write, I could speak, I could do some podcasts, and I could really just examine the things that I've learned and see if there's ways to sort of disseminate and spread that knowledge and learnings, and also figure out what the right questions are to ask as we go forward. There's a lot of misconceptions out there about mental health, about mental health policy, about mental health providers and programming. And, I've really been enjoying kind of diving into some of those.
How does it feel to write and talk about all this stuff?
I'll be honest. It was a change, right? So I had some dark moments in a couple months into this new role where I was like, what am I doing here? Like I went from this like really intense and constantly changing, job. I loved my team. I loved the collaboration and the energy and the challenge of solving really, really tricky problems. And then, I'm just sitting here in a room in my basement in front of a computer, trying to come up with something to say. And I was like, what did I do? Like I made a huge mistake, right? Um, but I think any kind of transition, that's normal. And thankfully I was able to talk to some folks who were like, look, you just have to start doing stuff. Like, and so, I had some thoughts and ideas. I started writing. I have a Substack, called Favorable Thriving Conditions. And so I write there. I started a podcast. I just started doing stuff and talking to people, and that's really, really made a big difference. I mean, there's so much energy in like the conversations, and so I've really kind of calmed down a 180 now. And I actually see myself as so lucky that I get to just like think about interesting things and talk to interesting, smart people. And that's my job right now, right? And I know it's not forever. I couldn't do this forever. Like I would get pretty bored. I think I do love the the ins and outs and the weeds of running things and building things and doing things. But for right now, it's a really interesting time we're living in, and I feel fortunate to be able to observe and comment on it.
With that, where do you want to see your journey in the next few years?
Yeah, so I'm trying to. It's cliche, right? But one day at a time. It's a really hard thing to do, right? I mean, we are I think hardwired to worry about the future as human beings.
Yes.
And it's there's a framing about mental health that I think is really interesting. That if you take the two most common manifestations of mental health challenges, right, anxiety and depression. They're really both about your relationship with time, right? So like anxiety is worrying about the future, and depression is sort of ruminating on the past. And the only way to combat those things is to really, really focus on the present. And so I'm really, really trying right now to just like first of all, have so much gratitude for the situation I find myself in. Like this is a really, really fun and exciting and actually fairly not stressful job. And I've had jobs that were the opposite, and like I would have done anything to be in a situation like I'm in right now. So I'm trying to have a lot of gratitude and think about just this time I'm in right now. So when you ask a question about where I want to go, I mean I hope to continue to write and speak. I hope to, like, there are a lot of things in the field of mental health, and mental health policy and mental health programming, that I think there's a lot of really good stuff happening that needs to be uplifted and disseminated. And I think there's some problems with how we think and talk about mental health as well, right? So, for example, one of my first two podcasts were both with people that are innovating really, really exciting things in the field of mental health, and I thought it was sort of my obligation to lift those folks up and tell their story and try to share as much as I can. That these are things that everybody should do, right? So whether it's a single session intervention, which is this idea that a well-designed single session of therapy can be as impactful in some cases as like a regular 18 to 20 or however many session course of therapy. And so and then there was another provider I had on who's implemented 4-day work week in their facility, and they've had so much success with staff satisfaction and retention and recruitment. And we always talk about workforce challenges, right, as like the number one barrier to mental health programming success. But here's a provider that took something and did something about it, and is having great results. And so I really try to highlight those positive things. And then, my next podcast is going to be with a couple folks who are in recovery, and we're going to talk about some of the misconceptions and problems within the recovery community itself as sort of a way to highlight, maybe there's some different ways of looking at things.
How can people reach out and learn more about you?
Yeah, so like I said, I write a Substack. It's called Favorable Thriving Conditions at Substack. And I'm fairly active on LinkedIn, right? So, I think that's the only social media that I think that's how we got connected. That's the only social media that I really do. And I don't feel great about it. Like I wrote a piece recently about my own internet doom loop, right? So everybody's got their doom loops on the internet, whether it's just like, whether you're doom scrolling on Twitter or looking at Instagram. And so my own doom loop heavily involves LinkedIn, which is like terrible and kind of and not the most productive. So, I'm actively working on the relationship I have with LinkedIn, but all that to say, I'm fairly active on LinkedIn as well.